Welcome to OB-GYN Associates, where we provide comfort, care, and trust through the practice of obstetrics and gynecology for patients of all ages, from adolescents to women of childbearing age to women who have reached their postmenopausal years. Our physicians are committed to your overall health and well-being. Along with our nurses, technicians, and staff, we strive to make your visit as comfortable and pleasant as possible. We accomplish this by providing you with the personal attention you deserve and cutting-edge healthcare to help you maintain a healthy, active, and enjoyable lifestyle. We begin by listening to your concerns and answering all of your questions. Together, we'll consider what's best for you and your family, and only then do we recommend the best solution or treatment. All of our physicians are on the medical staff at St. Bernard's, where we perform our surgical procedures. Because of the electronic medical record system in place at both OB-GYN and St. Bernard's, we can access your charts, x-rays, and any other health information instantly, which allows us to take better and quicker care of you. And if you require a procedure, the system calls for you to wear a Scantron wristband, which ensures your safety and accurate treatment. When it comes to women's health, no other clinic in the area has more combined years experience than OB-GYN Associates. Since opening our doors in 1972, we've expanded our services to include everything from routine gynecology and obstetrics to bone density testing and laser therapy. Let's take a closer look at some of these services. Our physicians at OB-GYN are honored to have been a part of New Beginnings for generations. We want caring and delivering your baby to be as special and worry-free as possible, so we make sure you receive close personal care along with the latest advancements in obstetrics. Catch a glimpse of your baby's world with our new 3D 4D ultrasound technology. All of our ultrasonographers are registered and certified, so you know you're in the best hands while you watch the miracle growing inside of you. Then, when it's time to meet your little one face-to-face, you'll be admitted to the newly redesigned St. Bernard's Birth Care Center, where we work with a team trained extensively in obstetrics. The Birth Care Center takes the safety of its families very seriously. According to the guidelines of the Centers for Missing and Exploited Children, obstetrics and nurseries should be placed at the farthest point from the parking lot. That's why the Birth Care Center at St. Bernard's is located on the 5th floor of the Medical Center. Other safety features include locked doors and surveillance equipment. The St. Bernard's Birth Care Center also has several resources to help expectant and new moms, including childbirth classes, new online birth care classes, and a lactation consultant. Mothers who are experiencing difficulties breastfeeding or who would simply like to learn more about the best methods may take advantage of group classes or individual sessions with the lactation consultant. Some expectant mothers need to be closely monitored due to high-risk pregnancies. These can be women who have medical problems before becoming pregnant, develop medical problems during pregnancy, or experience complications related to the pregnancy. Pre-existing conditions that may cause complications include high blood pressure, diabetes, thyroid problems, or autoimmune diseases. Your body's response to being pregnant can also lead to high blood pressure and gestational diabetes. Complications that may arise include premature labor or multiple babies. In years past, some of these complications and premature births have required local families to travel extensively, but not anymore. With the opening of the Neonatal Intensive Care Unit in the St. Bernard's Birth Care Center, your little one can receive specialized care from a highly trained team led by neonatologist Dr. Douglas Seglem. Should your little one arrive early, if he or she is 28 weeks or older and has no health complications, your family only has to go as far as Jonesboro to receive the best in neonatal care. By partnering with Arkansas Children's Hospital and UAMS, St. Bernard's now has one of 4 NICU units in the state and the only one in this region. There are a wide variety of conditions that can affect a woman's reproductive system. Some of those conditions may require a hysterectomy. A hysterectomy is the second most common surgical procedure among women in the U.S. They involve the removal of the uterus and may include one or both of the ovaries. Depending on the condition of the patient, the procedure can be performed vaginally, abdominally, or laparoscopically. using the minimally invasive Da Vinci surgical system. The Da Vinci surgical system uses small incisions and robotic technology that allows your doctor to have enhanced capabilities when performing your hysterectomy. The advantages of using this system are small incisions, minimal blood loss, a shorter hospital stay, minimal scarring, and most importantly, a quicker return to daily activities. You can rest assured that whatever your condition, we'll find the best and most effective way to treat it. NovaSure is a treatment option for unusual or long-lasting periods which affect almost 20% of American women. In the past, this condition was treated with hormone therapy or a hysterectomy, but now we offer a 90-second one-time procedure to treat your heavy periods. NovaSure is a quick, simple, safe, and effective endometrial ablation procedure that can be performed here in our office. For 90 seconds, a controlled radio frequency energy is delivered through a thin, handheld wand to permanently remove the lining of the uterus. NovaSure doesn't require anesthesia, and pain is very well tolerated. Simply put, it's a quick and easy solution to a common problem. More than 13 million American women suffer from urinary incontinence or loss of bladder control. It becomes more common as you age and can range from occasionally leaking urine when you sneeze or cough to experiencing such a strong and sudden urge that you can't make it to the bathroom in time. At OB-GYN, we use what's called a urodynamic test to measure your bladder function, and then we determine your best option for treatment, which may include medications, lifestyle changes, or surgery. If your condition does require a procedure, it's nothing to worry about. Procedures are outpatient, same day, and success statistics are high. In fact, many procedures are often performed in conjunction with a hysterectomy, which is a convenient and hassle-free way to prevent urinary incontinence. If standard treatments do not work, we also offer an injectable bulking agent called Coaptite, which is a toothpaste-like gel injected into the wall of the urethra near the bladder. After the injection, the gel bulks the wall of the urethra and prevents uncontrolled urination. Many women are embarrassed to talk about bladder control, but it's a common condition that can be easily managed or overcome if you simply talk to your doctor. One of our newest services used to treat urinary incontinence is InterStim therapy. You can set up a trial assessment for the procedure, which is a test without a commitment to see if it works for you. We begin by numbing a small area and inserting a thin, flexible wire near your sacral nerve. The wire is taped to your skin and connected to a small stimulator that you will wear on a waistband. This stimulator sends mild electrical pulses through the wire to the sacral nerve, which may correct the function of your bladder. If this works and you opt for long-term treatment, a neurostimulator is implanted during an outpatient procedure. Pelvic organ prolapse repair sounds complicated, but it actually occurs when one of the pelvic structures, such as a bladder or rectum, protrudes into the vaginal wall. Common causes of this condition are pregnancy, childbirth, menopause, obesity, aging, and genetics. Treatment options for prolapse repair return the prolapsed organs to a more normal position and strengthen the structures around the vagina to maintain support. Depending on your needs, your doctor can use either a synthetic graft material or a biological graft material. Both of these materials will conform to your normal anatomy so your body tissue can grow into it. This traditional method of treatment allows your body to form a framework of support for the normal positions of your pelvic organs. Osteoporosis is the most common type of bone disease in which your bones become weak and brittle. Bone density can be decreased by hormone levels and especially by drops in estrogen during menopause. It's important to keep your bones healthy and strong. So at OB-GYN Associates, we perform bone density tests, which measure how much bone you have. Then we know if we need to treat your bone loss with simple lifestyle changes, medications, or hormone replacement therapy. Also available in the clinic are a variety of laser services, which offer both men and women non-surgical cosmetic improvements. Precision laser therapy can be used to remove most common signs of aging and sun damage, from red and brown discoloration to lax skin and wrinkles, as well as to induce the body to stimulate new collagen growth in specific areas. Patients usually experience a slight tingling during the procedure. Depending on the size of the treatment area, treatments can take from 5 to 30 minutes or more, and most patients experience a considerable improvement after 1 to 6 treatments, depending on their skin condition and level of treatment. At the turn of a dial, the diameter of the laser can be changed from 1 millimeter to 5 millimeters, which makes your treatment time shorter. A very common laser procedure is spider vein therapy. Spider veins are located on the legs or face and appear either red or blue. Using laser scope technology, it becomes very easy to treat numerous sized vessels in one sitting. This technology can also be used for laser hair removal. Many individuals have had to endure the pain, embarrassment, and social stigmas associated with unwanted or excess hair growth, or shaving bumps caused by ingrown hairs. Our laser system, however, is the first to be approved by the FDA for all skin types, including dark or tan skin. Thank you for choosing OB-GYN Associates. We welcome any questions you may have about our policies, procedures, and treatments, and encourage you to discuss any and all concerns with your physician. Your communication with us is always the first step in the journey to a healthy, happy, and active lifestyle. Comfort, care, and trust.